see me, and I can do this like that. I will tell you about the pattern protocol of the ophthalmology. And pattern protocol is this, alright? Pattern protocol is this that I'm going to tell you about the ophthalmology here. And what I can say is that what are the different clinical questions that can be asked in pattern protocol of one of clinical ophthalmology examination paper in 4th year MBBS. Top 20 questions, and in fact these questions I've top 20, but I've made them, even equivalent to 40 with all the any possible type of questions, sub-questions within question. So what I can do is, the first is, what are the treatment modalities of myopia and index myopia in a 55-year-old male? Number 2, how will you manage case of squint case of esotropy in a 5-year-old child? Question 3, what is a blowout fracture and what are its complications, treatment? All effects of severe blunt ocular trauma, transfocal injuries. Basically they're concerned with ocular blowout fracture, edema. Then, of course, apart from that, scleral rupture and rosal chip cataract and lens subluxation and angle recession glaucoma later, and then what you call as all these kind of things, and even retraced hemorrhage and retinal break, choroidal rupture, even Berlin's edema, commercial retina at the back, and even optical convulsion. So then, question 4, how to grade thyroid eye disease with no aspects, pneumonic, including screening features and harmful effects on eyes. And 5, question, what are the clinical problems of lacrimal apparatus and what you call as evaluated clinical lacrimal tests and the causes of epiphora. Like here it can cause dacryoadenoides, but here it can cause dacryocystitis causing epiphora unilaterally, like that. And question 6, how will you rate trachoma according to its pathology and observe its, you can say, its clinical landmarks, trachoma, and of course elaborate safe treatment for its complications, like as for surgical treatment, A for antibiotics, F for facial cleanliness, and E for environmental hygiene trachoma. And question 7, what are the typical lesions, types of blepharitis, differentiate, diagnostic and therapeutic clinical measures among style calcium. And what you call, you can also do one thing more, that you can say question 8, clinical characteristics of acute adenovirus divided discus because of red eye. And question 9, differentiate between types of scleritis versus scleritis and their management regimen. And question 10, what are the various corneal function tests and cause of corneal edema and role of keratoplasty, transplant, diagnosed treatment of dendritic ulcer. Then question 11, what are the typical clinical features of acute anterioritis? And you can say it's baseline treatment and complication of chronic anterioritis, like exclusive papilli, occlusive papillary, pupillary block glaucoma, iris bump in secondary angle closure, glaucoma. Question 12, how do you classify glaucoma and drug therapy of BOAG, primary opening glaucoma, emergency diagnosis and management of acute ingestion, casualty. And question 13, classify cataracts and clinical diagnosis and management of cases of non-liquid cataract inside into Finch's test, stenographic sweat removal in front of the light, so like that I'm doing. And if it is incipient cataract, then the kaleidoscopic crystals will break up into kaleidoscopic crystals, colorful in circular fashion. While if it is corneal edema due to acute glaucoma, incipient glaucoma, then it just becomes hazy, but they don't break up like that. Incredible test, isn't it? And then question 14, what are the various characteristics of papillary anomalies and what is anisocoria? And discuss papillary reflex and whether it's papillary reflex or near reflex, papillary reflex, so direct and consensual and direct sensual, swinging flashlight test. And and for neuroflex would be, convergence, meiosis, and accommodation. Then question 15. What are the characteristic age-related changes in the eyes and in human eyes? How will you determine differentiate the clinical characteristics between cataract and one eye ceretic and the other? That is another. And and difference between cataract and pseudophakic. Pseudophakic cataract would give Purkinje images. Mature fourth would be hazy but visible. Mature fourth would be absent, and but iris should be present. Mature cataract. And the third Purkinje image also would be more or less an immature cataract, but if it is what you call pseudophakic, then shows the third image modified to a glistening reflex. Alright, a glistening reflex, that what will do. And then you can say question 16, classify types of refractive errors and describe the importance of pinhole tests, and roll terms conoid to describe variations and types of astigmatism, whether it's regular, irregular, regular, whether it is, you can say simple, compound, or mixed. And simple compound will be myopic and hyperopic, with one focal line sitting on the macula, the other in front or back. Similarly, in compound, both are front, and CMA or both behind, and CHA compound hyperastigmatism. Then is something that I've written myself, both, is the question 17, enumerate and describe the various categories of opacities in the optical medium to help vision, and which one is the most common. Question 18, types of cataract refractive KRS procedures, comparison between RK radial keratotomy and PRK phototherapeutic photorefractive keratectomy, then comparison between LASIK versus laser, and clinical characteristics of gazy keratoconus and emerging treatment modalities, even up to corneal collagen cross-linking, and which is after center chromium for some time, yellowness vision, yellow discoloration in vision, and question 19, difference between papillitis versus papilledema, and B, diabetic retinopathy is hypertensive retinopathy, and you can say the difference between RD retinal detachment versus RP retinitis pigmentosa, and finally, question 20, what is the neuroanatomy of human visual pathways, and enumerate and describe the range of VFD visual field defect in ophthalmology. And what I can say is kitty as well. And finally, on this yours as well there. And finally, I can show you a bit here. You can see here as well. See what happened if I close it here, and see a bit of procedure that I close and minified and going through hotspot shields, valve, everything, like this. And we're going to close it here so you can see better image here, like that. And similarly, if you can do a bit of here, make a bit of cleaning here as well. And we'll see cleaning the best your cleaners here. And we won't close Google Chrome with the other thing, Internet Explorer, like this, and application, let it run smoothly. Is it here? This is one. Alright, and then we can say this any privacy sweeper, you can see if it's coming, anything like that to count. Here, clean these cookies, chrome cookies, privacy and safety of the computer, and any junk files cleaner if any. Okay, it's clean, and what you can say is this one as well, cleaner, PC checkup, and we can see at the same time so many You can use so many here as well. See, at the same time, if you much of 2 GB RAM, it can be different. It can carry 10 out of 10 good, great. And here, start cleaning, common cleaner, advanced cleaner here as well. Negative run smoothly here. Yeah, this dictation here is going fine as well, I think. Yeah, doing great, I think. This documentation of the hardest drive HDDs. There's so many, I don't know, 4 but 8, 7 here, and I've got 3. You know, I've got 3 things here as well. And finally, here, this one, start clean up tools care, Wizard of Tools, Purist enough, free from Singapore. So let's see how much it cleans here. Yeah, thanks, good enough. And finally, yeah, it's gonna be. You can see me here, I think, and if I can line myself here, yeah, you can see here I was describing all these things, and I hope the sound is good enough. And now that I wear this here, headphones, and this is it. I'll start posting questions here. So this all it's gonna be, alright. I'm gonna close it. Small